oncoplastics reconstruction refers to any procedure where a plastic surgeon and a traditional breast oncologist are working together. So the most common variant of that would be a breast reduction and a lumpectomy at the same time. So for the patients that choose to undergo a breast conserving route, meaning a lumpectomy with radiation, then we can potentially do a breast reduction or a breast lift at the same time to reshape the breast, make it look more uniform, and then at the same time we can do a symmetry procedure on the other side to give symmetry. So there are a number of options when we talk about breast reconstruction. To simplify it, there's two broad categories, and those two are implants and flaps or your own tissue. We can divide each of those categories out into a whole slew of other options. When we talk about implants, we have saline implants, we have silicone implants. When we talk about silicone implants, we have round implants, we have shaped implants. So depending on what the patient is looking for, the approach to the mastectomy, we can use a whole world of these various types of implants. Flip gears, when we talk about using a patient's own tissue, this means we're taking tissue from somewhere on the body with blood supply and moving it to the breast. And theoretically, the entire breast is then being reconstructed with just their own tissue. There's an alphabet soup of options. The most common that we do is called a deep flap. That stands for deep inferior epigastric perforator flap. And that comes from the tummy, where we can take tissue from the tummy and bring it up to the breast, and then use that tissue, skin and fat only from the tummy, to reconstruct the entire breast. There are other options. One of the other ones we do commonly is a pap flap. It comes from the posterior thigh. That's a profunda artery perforator flap. And we can use that to do total reconstruction as well. I think when choosing a plastic surgeon for breast reconstruction, you need to look for a couple of key things. The first one is, of course, you want to go to someone who's board certified. That means they've been vetted by the Board of Plastic Surgery. They're experienced, and they should be qualified to do this surgery. The second thing you want to think about is you want someone who actually does breast reconstruction. There are plenty of people around the world that do a little bit of breast reconstruction or dabble in breast reconstruction. But I think the key is that you want to go to someone who this is their passion. This is what they do on a daily basis. And because of that, those people are going to give you better results, shorter surgeries, and just better outcomes in general. In preparation for any breast reconstruction, I think it's important to do your homework. And that goes back to picking a surgeon, just deciding what route you want to go with the process. It's certainly a very overwhelming process. So ask questions, make a list of questions, and make sure you are as formed as you can be to proceed with the surgeon and your chosen path. Other than that, the goal ultimately is for you to be a healthy person. So anything that can make you healthier is going to make you do better. That can mean eat more protein, don't smoke, things like that. Just general health. If you have diabetes, control your diabetes. All of those variables will help your surgical outcome in general, but specifically to breast reconstruction is extremely overwhelming. So just do your homework, be comfortable with your choice and your surgeon. The difference between recovery when we compare implants and natural tissue or a flap depends a little bit on where the location is and what tissue we take. It also, of course, depends on the patient. Recovery is certainly patient-specific. Theoretically, implants are an easier recovery. In most situations with implants, we're able to go through the same incision as a tissue expander was placed. That tissue expander comes out, implant goes in, and most people don't have a lot of pain. Now, that being said, in my patients, I offer pretty much everyone fat grafting, which then means now all of a sudden we're not just operating on the breast, we are now operating on a different part of the body. So that means there is a recovery from that. So that means liposuction of the thighs or the tummy or something like that. And while that's not a big recovery, it is some downtime and it is some discomfort. So what I typically will quote patients is they're usually pretty good by about 3 or 4 weeks, and I restrict them for 4 weeks. If we go with shaped implants, then I ask that they wear a bra for 4 weeks, and I ask that they don't do anything strenuous for 4 weeks. And the reason for that is we don't want those implants to rotate. They're designed to sit as a very specific way, and anything that's too aggressive or too much motion can cause those to rotate. In contrast, for the flap surgery or using your own tissue, most of the recovery is dictated by the donor site, not necessarily the breast. The breast people typically tolerate very well. It's more of the tummy or in a deep flap or the back of the thighs and a pap flap. And in those situations, we typically restrict people for 6 weeks. And that's to avoid any wound problems or any internal problems or anything like that. But after 6 weeks, most people can go back to pretty normal activities. When people are considering implants, there's a number of pros and cons. Specifically for the advantages is it's typically a more simple surgery than some of our alternatives. If a tissue expander has been placed, then we go back through that same mastectomy incision, we remove the tissue expander and the implant goes right in. That can be done in potentially an hour. So it's a relatively quick surgery, minimal downtime in the sense of pain and recovery. And the implants can look great. It can give a very youthful breast. That being said, there are of course some negatives. So for an implant, it feels different than a natural breast. It feels like a silicone implant. While some people like that, it can be a little bit firmer and it can be a little bit uncomfortable for some patients. Probably the biggest negative related to implants is, unfortunately, we call them a permanent implant, but there's really no such thing as a permanent implant. So at some point, these implants will fail. It's not a matter of if, it's a matter of when. We typically quote a 10 to 12 year survival for these implants. So for a lot of patients, and as we start diagnosing earlier and earlier cancers in younger patients with genetics and such, these patients are looking at surgeries later in life regarding their breast and their reconstruction. So we do have to think about that. When considering doing natural tissue reconstruction or reconstruction with your own tissue, there are a number of advantages and disadvantages. So the biggest advantage to going this route is that it's your own tissue. You don't have an implant, no foreign object you have to worry about. It is your own skin and fat from a different part of your body. Typically that skin and fat will feel very similar to a breast. So that means soft, pliable tissue and more comfortable because it actually integrates and becomes part of the patient. The other great advantage is once we get that tissue from point A to point B, meaning if it's the tummy, we're bringing it from the tummy to the breast, it is there forever. So there's a great advantage to that. It'll be there 30 years from now. The downsides, of course, relate to the donor site. So in contrast to an implant where we take something off the shelf and put it in a patient, in a flap, we're borrowing tissue from another area. That means a scar in another location. That means wound healing in another location. So there is some negative to that, some downtime. That being said, many people will flip that around and, in the tummy, for instance, in a deep flap, people will quote that it's similar to a tummy tuck. And while it is similar, because you'll get a contour improvement, it's not the same. So it depends on how you view that in the sense of, is that a disadvantage, is it a pro, and kind of your goals in life. So there are a number of options when we talk about natural tissue breast reconstruction, or a number of terms, autologous tissue or flap surgeries. The most common, at least in our practice, is a deep flap, and that stands for deep inferior epigastric perforator flap. And that's a mouthful, but what that stands for is the blood vessels that supply, that keep alive your skin and fat on your tummy. So we're able to take that skin and fat off your tummy with those blood vessels and bring it up to the breast. That's certainly the most common because most people have a little bit extra tissue there and are happy to get rid of it. For our patients that have either had previous surgery in that location, maybe they've had a tummy tuck, maybe they've had liposuction and they're very thin there, or maybe they're a marathon runner and they just were really thin in their tummy. Most of those patients will have another site that we can find tissue. The most common in our practice for that is a profound artery perforator flap, a PAP flap. And that is it's an elliptical piece of skin and fat that comes from the back of the thigh and the inner thigh. We're able to take that just like we just said about the deep flap and bring that up to the breast for total breast reconstruction. That's certainly the most common in our practice of second options. There are some others that we can consider if those aren't available, but in 99.9% of patients, one of those will work. So Dr. Tioshi and I work together routinely doing these larger flap type breast reconstructions. And there are a number of advantages when we do that. Probably the biggest advantage is it's a shorter operation. So we're able to work simultaneously. One of us starts on the recipient site, meaning the breast. One of us starts on the donor site, typically the tummy or the thighs. And because we can work in concert, it's going to speed it up. And we've been able to shave, hours off of these operations. So that's probably the biggest advantage.
Another one is that these are complex procedures that take some time, and it also occurs in other specialties. But when you have to troubleshoot in a long, complex operation, it really helps to have another brilliant mind next to you who is technically capable and thinking alike you in the same realm where you can achieve the success for the patient. So there's 1,000 decisions to be made in most surgeries, and in something like this, the stakes are high as well. And so we can maneuver around and be creative and come up with a plan that works for that patient for that particular time. So co-surgery is vital, and we don't operate separately any longer in something as long and complex as this.
So a lot of patients worry about having drains after reconstruction. And the truth is almost no matter what route you go, you're going to have some sort of a drain for a short period of time. At the time of mastectomy, drains are going to be placed. At the time of a secondary reconstruction, in most types, a drain is going to be placed. So when flaps are done, drains are placed. At least in my patients, when I do shaped implants, I place drains. The truth is, it is in for a very short amount of time. That may be 1 week, could be as much as 3 weeks. But in the grand scheme of life, it's a very short amount of time, and most people tolerate them very well. In many situations, the nipples have to be removed at the time of mastectomy. And that relates to the location of the cancer, the type of the cancer, and the specifics of the breast anatomy. In those situations, there is always an option for for nipple reconstruction. Now that typically is the final surgery that we do in the reconstructive process. So that may be a few months after each step. And then at a later time, once that's healed, we can come back and we can do a tattoo. As a complete alternative to that, some patients will do a 3D tattoo. And in that situation, there is no actual projection. So we don't actually do a nipple reconstruction and give the projection, but a tattoo mimics it and gives the appearance of 3 dimensions. So there's really 2 options when we talk about nipple reconstruction. I love what I do. So I'm very fortunate in the sense that I'm probably one of the few people that every day when I go to work, I get excited to get up and go to work. I'm lucky in the sense that I chose this field. It has a combination of technical aspect as well as a creative and artistic aspect, and that's perfect for my personality. So yeah, I love what I do.